This is LFP Billing Tips. I'm Dr. Namrata Jhamb, family physician from Burnaby, BC, and I provide obstetrical care at Royal Columbian Hospital. We're going to talk about the LFP birth code, billed as 98173 for longitudinal family physicians with a patient panel, and 98273 for locums covering for a host physician. Both 98173 and 98273 are billable in any setting where a patient gives birth, including hospitals and out-of-hospital settings such as home births. In order to bill facility-based pregnancy and newborn care, first, you must be enrolled in the LFP payment model. This means you have submitted 98000 as a longitudinal family physician or 98005 as an LFP locum to MSP in the calendar year. Second, you must have also submitted the Pregnancy and Newborn Care Setting Registration Code 98006 to MSP in the calendar year. Third, you must have privileges to provide family medicine obstetrics care in a health authority operated or affiliated hospital. And finally, to bill the birth code, you must be the family physician who is either responsible for managing the birth or responsible for co-managing the birth with an obstetrician or a family physician with privileges to provide enhanced surgical skills for operative delivery, or be the second attendant at an out-of-hospital birth. 98173 is payable for in-person management of a spontaneous vaginal birth, vacuum-assisted birth, forceps-assisted birth, emergency C-section birth, and pregnancy losses from 16 weeks gestational age. There are no additional interaction codes billable for using a vacuum or a forceps for a delivery. Reminder that emergency C-sections are included in this list, but elective C-sections are not. Elective C-sections are instead billed using the LFP pregnancy-related surgical assist code 98174. For most scenarios, you may bill either the birth code or the pregnancy-related surgical assist code, but not both. For more information and examples on when you sometimes can bill both codes, please see our LFP billing tip on the LFP pregnancy-related surgical assist. Now, let's do some examples. Case number 1. While you are at the hospital, your 36-year-old laboring patient requires an emergency C-section due to abnormal fetal heart rate. You are the physician managing the birth and are present in the operating room. The obstetrician performs a C-section, and your colleague provides a surgical assist. Can you bill 98173 in this scenario? Yes, because you are the most responsible physician for the birth. To bill, you will submit 98173 for the in-person management of the emergency C-section birth. You will also bill the appropriate pregnancy and newborn care direct patient care time for your time spent managing the birth with the patient present. But you will not bill the surgical assist code, as it is not payable in addition to the birth code in this case. If your colleague who provided the surgical assist is enrolled in the LFP payment model for facility-based pregnancy and newborn care, they may bill the surgical assist code since they provided the surgical assist, and they were not the physician managing the birth. Let's do another example, case number 2. You are the most responsible physician managing the birth for a 29-year-old patient. An emergency C-section is required for first-stage dystocia, and the obstetrician provides the C-section while you provide the surgical assist. What would you bill in this case? You will bill the birth code and the appropriate pregnancy and newborn care direct patient care time, since it was an emergency C-section and you managed the birth. But can you also bill the surgical assist code? The answer is no. The surgical assist code is not payable to the same physician in addition to the birth code. And our final example, case number 3. You are managing the labor and birth for a 31-year-old patient with a twin pregnancy. The patient has a spontaneous vaginal delivery for both babies. What would you bill? Remember, the LFP birth code can only be billed once per patient per pregnancy, not per baby. In this example, where twins are delivered, 98173 should only be billed once. However, you will also bill direct patient care time, which captures the additional time required to manage this multiple birth. Now you can feel confident when billing the LFP birth billing code. After having watched this video on the LFP birth code, watch the LFP billing tip on the pregnancy-related surgical assist codes 98174 and 98274. Other helpful links can also be found in the description. If you found this video useful, click the subscribe button below to see more LFP billing tips.